Folks are connecting. The waiting room looks empty. One more folk connecting to audio, and looks like we're all here and ready to go, sir.
Okay, thank you, Miles. Really appreciate it. Thank you all for being with us here from this briefing. As you can see, this briefing is coming from SFO, our mass vaccination site here. Just so proud of the work that's going on out here with our county staff, with county health, and all our folks from the EOC, and certainly our sheriff's office who are working on logistics out here. And more about that in just a minute, but let's go to the numbers. As you can see, let me start with that. Unfortunately, we're at 481 deaths. January was a particularly just a terrible month for us. And we're hopefully we'll start to see these numbers come down, but undoubtedly we'll unfortunately reach over 500 as we continue to see the trends of double-digit deaths in a week period. As you can see from the charts here, it's still the age group of that 20 to 29 that continues to surge. We've got almost 38,000 cases that are not as good, which is great. We can go to the next slide. This is what we wanted to see. Some of these numbers start to come down in the way of hospitalizations and ICU beds being more available, along with acute care beds, which is certainly headed in the right direction, but a ways to go still. We go on to the next one. And here you can see some of the lab results, how we're turning around. And again, testing remains important, and we don't want people to lose sight of the necessity to get tested, in light of the fact that we're vaccinating people. This is certainly one of the pillars that we're encouraging people to continue to utilize. So let me go on to testing, because we've got a lot of testing going on. Just almost 17,000 last week. So we had 8,437 tests from Curative and Optum. And we had 1,500 at the North Fair Oaks, 2,900 at the College of San Mateo, 2,300 in Daly City, 278 in East Palo Alto at the YMCA, and 298 at the East Palo Alto Home Depot. And then 359 in San Bruno at the Church of Jesus Christ of Latter-day Saints, 340 from the mobile Optum Serve, and 275 from the Curative Serve. So we'll continue at College of San Mateo this week, Sunday through Thursday, and certainly in North Fair Oaks, in East Palo Alto at the YMCA, in San Bruno at the Home Depot in East Palo Alto, and then Curative will be in North Fair Oaks, Redwood City, East Palo Alto, San Mateo, and Daly City at 600 tests a day. So as I mentioned, testing remains one of the pillars of the county's pandemic response, and we can't lose sight of that. We still remain, remember that blueprint to recovery has some areas that we've got to hit. We still remain #1 in the state in regard to testing at 876 tests per 100,000 population. So that's something to be very proud of. And our Office of Sustainability Director, Carolyn Blady, has taken over for Justin, done a great job there. So an announcement over the last week, we've made some changes to the testing sites. A new mobile van location at Our Lady of the Pillar Church in Half Moon Bay. So in alignment with our equity commitment, we continue to look for opportunities to provide early testing access to community of needs. And we really, truly have now reached all 4 corners of this county. And we continue to try to make sure that everyone has equal access to testing. So let's talk about some of the numbers, because this is so critical to our recovery and the ability for us to open to a different and move to a different tier. So the adjusted case rate per 100,000 is at 9.6, which is terrific. We haven't seen that in a long time. Still in the purple tier. We need to remember drop below 7 to get to that red tier on case rates, on adjusted case rates. But think where we've come from. Just a mere month ago on 1/12, we were at 36.3 adjusted. That was incredible, and that was just about 62.9 unadjusted back then. Our unadjusted case rate right now is 19.3. The positivity rate remains very good, and this is very encouraging at 2.8 as of 2/16. And remember, that puts us in the orange tier, and that orange tier is between 2.0 and 4.9. But the real encouraging news is in the health equity metric. We're at 4.6. So that puts us in the orange tier. Remember, that orange tier is between 2.2 and 5.2. So that 4.6 puts us pretty solidly in the orange tier for the health equity metric. So what does that mean? And this is key to our ability to reopen. Since the county's equity metric has been in orange, if it remains there for one more week, the county could be eligible to move to the red tier next week. It would be next Wednesday. So that would mean that we would move on to greater reopening of retail at 50% capacity from the current 25. Restaurants can move from outdoor service only to indoors at 25% capacity with modifications, and gyms could reopen indoors at 10% max capacity with modifications. All good news, all headed in the right direction. We want to make sure that health equity measurement continues to head in the right direction, as well as our case rates. And that is critical. We don't want to lose sight of that we want our case rates to be heading in that direction. We did have a press conference out here today, just really highlighting all the great work going on out here. And I just got to highlight our Office of Emergency Services, our Deputy County Manager, Leona Rodriguez, the Sheriff's Office, certainly Health with Dr. Chambra and Sarija and Louise, for all that they have done to really make this really happen in a meaningful way where we're passing people through. Overall, we've given out over 100 and almost 110 individual doses. I'm sorry, 109 individuals have received 146,000 doses. So this is 17% of the population, San Mateo County, age 16 and over. This includes 63,000, almost 64,000 residents age 65 and older, and 48.5% of the county's population is 65 and older, which is great news. And for 75 and older, we've got 56.9%. So we continue to vaccinate. We've continued to look for in-home support services providers. We're at 32% of them, and some 6,000 members there. We are continuing at the event center, where we vaccinated over 9,500 healthcare workers from 2/8 through 2/11 with zero waste, and Carbon Health and the EOC providing staffing. So we will continue phase 1 healthcare workers, and certainly we're now expanding to 65 and older out here at the event center. Not only are we doing our safety net population, but we've expanded that to anyone, no matter what health plan you are, 65 and older, whether you're Kaiser, Sutter, HMC, Dignity, you have an opportunity to register and get vaccinated out here. And the philosophy really is, look, we want to get to herd immunity as quick as possible. We know we can do it in a mass way out here. The folks that we're charged with in safety net are difficult to outreach to, and we continue at every level to try to outreach to them through our trusted community partners, via phone in any other way that we can, because it's so important to make sure that they understand that they have the opportunity to get vaccinated. So we continue all efforts on that front. So we will continue out here for today and tomorrow, and then Friday. So in a short period of time, we are looking at doing, with really a 4-day period, last Friday, today, tomorrow, and Friday, about 12,500 vaccinations out here. We could scale that if we had more doses, and again, it all comes down to doses. We're only using 4 floors of this building. We can add capacity on each floor. We can go use all 7 floors. And we feel that we could, certainly reach between 10 and 15,000 a day if we had that ability to get that many vaccines. The vaccine on the vaccine front, it still remains spotty. We were supposed to receive information last night on how many doses. We have not received that information yet. It makes it difficult to plan. This is Blue Shield taking over. We hope to increase our doses, but it's hard to plan and get people mobilized. We have 150 volunteers out here today, and we'll have those tomorrow and Friday, Friday as we move forward. But it's hard to set that up and plan without that lead time that is so important. We have created up to 350 medical volunteers using NAC.com with 70 taking up volunteer shifts. And we're looking to partner with the Red Cross to develop a model for engaging volunteers in mass vaccination. So we're also looking for flaggers and those who will do admin work of checking people in and so on. Just real quick on the Great Plates program, we are currently serving 4,339 participants. We've served almost 1.6 million meals, which is incredible. We'll hope to get to 2 million meals. 75 active restaurants are participating. That's money coming back into the economy, keeping people employed, which is terrific. They are just doing a wonderful job. Masks continue to roll out. We did 2,500 last week for a total of 25,000. We've still continued to outreach through as many facets as possible through our Office of Community Affairs with our trusted CBOs, and we'll continue that outreach even now more than ever. It's important on both fronts, the testing and the vaccination. So with that, I'm happy to open it up for any questions. Miles.
Yeah, great. So I've got one question here typed in from Astrid, which is, how will the vaccines be rolled out next week for the next phase of folks, teachers, farm workers, first responders? Will it be via vaccine clinics?
It will be via vaccine clinics, and I'll let Sarija talk a little bit more about that. But we understand the necessity to get those folks vaccinated, and we're doing our part. Even though it's not a perfect system where, these are not typically in the safety net population, we understand that really this population needs to be vaccinated. And we're going to help out to the extent we can while still focusing on our safety net population. So Sarija, you have some more information on that?
Yeah, so fortunately, many individuals who are in these 4 sectors have a pathway through their health insurance and through their healthcare provider entity, especially when there are major insurers like Kaiser that offer affordable health insurance covering many of these individuals. At the same time, we know that the supply constraints have not made it possible for the major multi-county entities to reach all of their 65 plus population, to offer vaccinations to all their 65 plus population. So the approach that will begin next week continues to lean significantly on the pathways available through the multi-county entities, as well as the role we can play for those that don't have a pathway, and to enable a start at it for those who have shouldered the most exposure. So working with these sector leaders, such as Superintendent Nancy McGee for the education sector, the Child Care Coordinating Council and First Five for the child care sector, partners that have been working with us on the restaurant relief program, and partners like in Second Harvest, as well as, of course, our incredible law partners, the law enforcement agencies. We're striving to find ways to reach those that have shouldered the most exposure, while knowing it'll take some weeks for these workforce sectors to be fully reached by the major entities who are getting the supply to vaccinate them, but the supply remains a constraint.
Great.
Great. We have a few more questions, but quickly, Henrietta, you wanted the Great Plates slide up again, so I'm just going to share this real quick while I get to the next question for you. I have two questions that I believe are have been unanswered from Sierra. I think Sarija answered one of them in the chat. The first is, where is the county at with vaccinating those in its safety net? And the second question is, how has the county been affected by Blue Shield taking the lead on vaccine distribution? And what will the relationship look like moving forward?
Let me answer the second one first, and I'll give Sarija an opportunity to fill in. We don't know what that relationship looks like yet because they just took over. We hope it's going to be a great relationship. We look forward to working with them, and we look forward to getting as many vaccinations for folks in this county as possible. Look, you know, we've said this all along. Send us as many vaccinations or doses as you can of the vaccination, and we will get it done in this county. We will vaccinate people in a massive way, but everyone is constrained by the limitations of how many doses are existing today. So we look forward to the day, but we think that we'll have a great relationship with them like we normally do. We have a great relationship with Kaiser and Sutter and Dignity and AHMC, and you know, we're all in this together. And I think that that's what we've got to focus on. And every shot we give out is one step closer to ending this pandemic. So it doesn't matter if it's come from Kaiser, from PAMF, from Sutter, from Dignity, from the county. We want to get through this, and we're all in it together to do it. Sarija, do you want to take the first part and maybe follow up with the second?
Sure. So just the only follow-up comment I would make about the Blue Shield role and our work with Blue Shield is we did learn late last week that the Blue Shield arrangement is going in tiers, and most of the Bay Area counties, including San Mateo, are in the third phase of one component of this, which is the My Turn statewide platform. The date we learned is March 15th for that to become available and turned on, to fully mobilized in San Mateo County. The onboarding will start on March 15th. And the rubric that Blue Shield is using has to do with case rates and fatalities and exposure levels across the state. And one of the aspects of the Bay Area region, as difficult as it's been and as many sacrifices as so many residents have made, the Bay Area has fared a little better than other parts of the state. So they are not getting Blue Shield's first attention. Most of the Bay Area counties are in the third part of Blue Shield's rollout. So the first question, I think on Sierra's chat, I'm scrolling and talking and typing, had to do with how we're doing with our safety net population. And we're making progress in the safety net population as well, and so many trustful pathways through clinics, clinic partners, whether it's our San Mateo Medical Center that's offering vaccines at every one of its major primary care clinics, the Ravenswood Family Health Center, Northeast Medical Services, Gellert Clinic. I know from the county operated, the San Mateo Medical Center, we have about 5,000 patients over the age of 65, and we've reached about 29% of those so far for first doses. We continue to vaccinate at each of our clinics every day, and we're learning a lot about the outreach paths and the lead time that's necessary to arrange the supports for folks to use the pathway that's best for them. Some of them, a site like the SFO or the event center can work really well. Others would prefer to get it in their clinic and be getting it from their doctor or their medical team on site at the clinic. And we've learned a lot from Ravenswood and our other partners as well. Also, the health plan of San Mateo, which ensures about 100,000 low-income residents. We know that over 1,400 were reached in a single day at the event center a couple weeks ago, and more than 800 were able to complete second doses just in this last week. So it's, we want both speed and equity. You know, those have to go hand in hand. And for some of the populations that have shouldered the most exposure, we need to make availability predictable so that when they're ready, you know, we're ready to receive them with all the supports that are necessary to make sure it's a great experience for them. Great.
We've got two more typed in questions. First is, given the possibility of a third shot for some variants, what considerations are being made? And the second question is, how can you tell us about the federal pharmacy program and how that's working for the county?
Sarita?
Yeah, so in terms of whether additional vaccine boosters might be necessary to mitigate the variants, we don't know yet. There's a lot of science that's happening, and both Pfizer and Moderna, we understand, are developing, potential booster scenarios. But there's a lot that's being learned as we're sitting today about these variants. And both the Pfizer and Moderna vaccines, as well as the Johnson & Johnson vaccine that's expected to be considered by the federal government very shortly, are very safe and very effective in protecting against the disease taking a major hold. And so we'll continue to learn if there's additional elements of the vaccine rollout that would have to be added on to address aspects of the variant strains. And then the first part, in terms of the federal pharmacy partnership, we have seen a lot of progress with the congregate facilities. Almost all of them have completed first doses, many in second doses. We have really just appreciated the reach that program has had for the more than 500 facilities in San Mateo County. The specific additional federal pharmacy partnership with Rite Aid and CVS includes 5 stores in San Mateo County. And those stores are learning through the partnership, how many doses will that mean? And what does that mean for the number of appointments that are available? We've received word from grateful residents. This worked for me, it was right around the corner. So we know that can be a really accessible option. We understand that the vaccine supply to those pharmacies will be increasing, but don't have details on that yet.
Great. We don't have any more typed in questions. No one has their hands raised. So if there's no other questions from the group, I believe that would be it.
Great. Thank you all for joining us. Have a great couple of weeks here. We'll see you in 2 weeks on a Wednesday. Hopefully we'll be in the red by then. Till then, stay safe. Take care.